Good morning, everyone. My name is Jeanette Mallory. I'm with Blue Cross Blue Shield Arizona, part of their Medicaid line of business, Health Choice. I'm excited to be presenting our next keynote speaker, Dr. Oscar Rojas Perez. He's going to be presenting on Latinx immigrant mental health in the United States, how the past affects the present. I'm so happy to be presenting this speaker because he's very important to us in the community and also nationally, and his work is very instrumental into making changes. Dr. Rojas Perez is an associate research scientist at Yale University School of Medicine. He received his doctorate from the counseling psychology program at the University of Missouri. And he completed his pre-doctoral internship at La Clínica Hispana at Yale. Well, his professional contributions focus on the development and cultural linguistic adaptation of measures and interventions, Latinx immigrant well-being and trauma, and multicultural responsiveness training. So I am happy to turn this over to Dr. Rojas Perez.
Thank you, Jeanette. That was a wonderful introduction, and thank you for the invitation. I want to express my gratitude for the opportunity to present, and it's an honor to share this space with everyone here today. And good morning to folks. Good morning, afternoon, depending on where you're at. Good morning and afternoon. So the agenda for our time together includes a brief introduction on the Latinx population in the United States, migration and migration patterns, mental health related concerns among the Latinx community in the United States, with a specific focus on historical and present day trauma, recommendations on how to better serve and advocate for the Latinx community, and hopefully we have some time for questions and answers at the end. I'll make sure we have enough time. So before moving forward, I want to note that we will be discussing events and showing images that have been deemed traumatic and can be triggering and prompt uncomfortable emotions and thoughts for some folks. So I just want to put that filler out there. To set the stage, I want to highlight this quote. If you've come to help me, you're wasting your time. But if you've come because your liberation is bound up with mine, then let us work together. We need to understand the context, in this case, migration context, before we engage in any type of liberation work with the Latinx community. Knowing the context will give us insight into the lived experience of the people that we're working with. In Latinx psychology, we stress the importance of knowing the context when working with minoritized and vulnerable populations, because we understand that there are structural factors purposefully designed to intentionally harm Black and Brown communities. And I use the term Latinx to encompass everyone who identifies as Latinx, including those who are gender non-binary. Now, I want to emphasize that it's challenging to talk about the mental health of Latinx immigrants without considering the social justice sphere and political implications. As a result, the goal is to discuss the implications of systems and policies on the social, community, individual, and family of Latinx immigrants, which typically brings this topic to the forefront of mental health practice. Now, let's take a brief dive into the Latinx population in the US. According to the 2020 census, Latinx in the United States are highly represented in the West Coast, Southwest, and East Coast. And now there are many reasons why we see many Latinx, certain subgroups in certain parts of the United States, and I'll share one example in the next slide. But before I move on, I want to make a point that when working with Latinx community, it is important to recognize the diversity and heterogeneity that exists within the Latinx community, ranging from language and dialect, cultural heritage, nationalities, race and ethnicity, inclusive of Afro-Latinxes, religious and spiritual orientations, and documentation status. So vast differences across all Latinx groups. Now, as I mentioned earlier, there are reasons why certain subgroups of Latinx reside in certain parts, in certain regions of the US. Take, for example, the Mexican community. Before the US-Mexico War, this is what the US looked like. Not that much, right? After the war, the US took almost half of Mexico. Conflict between Mexico and the United States began after New Spain, pre-colonial Mexico, gained independence from Spanish rule in 1821. At the forefront of this conflict was the Republic of Texas, in which the US and Mexico disputed over who Texas belonged to. Eventually, Mexico lost Texas, half of its territory, including present-day Arizona, California, Colorado, Nevada, New Mexico, Utah, and Wyoming, which is known as the Treaty of Guadalupe Hidalgo, signed in 1848, with Mexico seceding half of its territory for $15 million. This is why we see a large number of the Mexican community in the West Coast and Southwest part of the US. A key point that I want to make is that the Mexican community never crossed the border. Essentially, the border crossed them. The US could have also taken all of Mexico and eventually taken all of Central America, but they didn't. Part of the reason had to do with racism. The US did not go further south because the further south they went, the darker shades of brown they saw, and they wanted to keep the US as wide as possible. Such perspective prompts me to think about the experiences of internalized racism among certain groups, which may manifest in low levels of self-esteem, self-efficacy, self-worth for some Latinx folks who are on the darker end of the color spectrum. Essentially, it makes me think about colorism, which features and skin tones are deemed superior over others, and how these messages continue to be passed down from generation to generation, impacting the mental health of certain Latinx groups. Now, let's look at the present day Latinx community in the United States. So outside of Latin America, the United States is home to the largest Latinx population, making them the second largest ethnic group behind non-Latinx whites. Today, the Latinx population accounts for 19% of all people in the US. Of that 19%, 19.8 million Latinx have been reported being born outside. Finally, Latinx are also projected to account for 28% of the population by 2060. These numbers highlight the browning of America that is taking place right in front of our eyes. Trends in Latinx growth have been associated with migration, and we don't even have to look that far back. Since the start of 2021, there has been an increase in the number of migrants at the southern border, which is the result of a humanitarian crisis in Central America that has been years in the making, resulting from natural disasters, gang violence, corruptions, and high rates of femicide, which is essentially violence and murder against women. We're also starting to see a large number of Venezuelan and Cuban migrants entering the United States through the southern border. In March of 2021, US authorities apprehended more than 171,000 migrants at the US southern border. This is the highest monthly total in 2 decades. The last time we saw numbers like this was in the early 2000s. The total included about 19,000 unaccompanied migrant children, 53,000 family members traveling together, and 99,000 single adults. Now, I want to highlight that the unaccompanied migrant crisis that we're experiencing is nothing new. When we look at the history of Latin America, specifically Central America, we see that unaccompanied migrant children have been coming to the US since the 1980s as a result of the civil wars in Central America, in which parents would send their children to avoid them being recruited by military forces and guerrilla forces. Now, before moving forward, I want us to look at the following from a historical and collective trauma lens, and think about how the events that we'll be discussing have manifested within the Latinx community today. As we all know, historical trauma or generational trauma refers to the transferring of trauma between generations. And collective trauma refers to the psychological reaction to a traumatic event shared by any group of people that can affect even an entire society. The effects are substantial, and the process can destroy a person's sense of purpose, negatively impact their confidence, their worldview, how they make meaning of the world, their mental health, and essentially their self-worth. From research, we know that colonialization, oppression, marginalization, and intergenerational and collective trauma negatively affect the physical, psychological, and socioeconomic health of Latinx immigrants in the United States and their families back in the country of origin. Historical trauma as a result of structural racism has laid a foundation for socioeconomic challenges experienced by Latinx immigrants in the United States, including high levels of poverty, underemployment, low levels of educational attainment, oppression, discrimination, and racism. Additionally, socioeconomic and sociocultural and social environmental factors that impact the mental health of Latinx immigrants include targeted marketing of alcohol, accessibility to substances, disorganized neighborhoods, and increased police surveillance, which again are rooted in colonialization. Historical trauma among Latinx immigrants has also been linked to mistrust in government institutions, unresolved ambiguous grief, and anger. In essence, mental health concerns and substance use concerns have been linked to historical and collective trauma within the Latinx immigrant community. Recognizing the interlocking effects of colonialization, oppression, and marginalization as they relate to presenting mental health concerns and substance use concerns among the Latinx immigrant community is an important step in connecting structural causes to contemporary identity development, how they make sense of who they are, mental health presenting concerns such as depression, anxiety, trauma, etc., intergenerational trauma, experiences of colorism, health, and overall well-being. Now let's take a brief dive into reasons for migration and migration patterns. And again, keep the trauma lens perspective as we go through this process. Migration from Latin America to the US is rooted in what has been described as push-pull factors. For example, in economic crisis, we can look at Venezuela, which often leads to a high rates of poverty, which can push people to migrate to the United States seeking economic opportunities. And economic opportunities in the US can pull people into the United States. Gang and political violence and corrupt governments push people out of their home country as a result of instability and fear of being murdered, while family reunification, healthcare, educational opportunities can pull people into the United States. It is also important to recognize that there has been a change in migration trends. Before, it was common for people to migrate voluntarily because of economic opportunities, and we saw this throughout the 80s, 90s, and early 2000s, before the economic crisis. However, now people are being forced to leave simply to stay alive. Additionally, climate change is now one of the main reasons why folks are leaving Latin America. There is growing evidence that climate extremes are having a devastating impact on agriculture in Central America, affecting the livelihood of millions of farmers. Both droughts and floods have been shown to have a serious financial impact in rural areas. As a result, many families have experienced both food insecurity and financial instability, prompting them to leave their country. Similarly, violence stemming from gang rivalry and extortion by influential criminal organizations remain a severe problem in Latin America. Gang-related violence is an essential factor prompting people, including unaccompanied migrant children and young adults, to leave the country. Finally, it is important to note that the migrant woman is now the face of migration. Before, it was men, with many studies citing that large number of women are fleeing their country of origin as a result of femicide. When we think about femicide, Central America, specifically Honduras, El Salvador, and Guatemala, they were known to be the capital of femicide in the past, 5 years or so. So to better understand mental health inequities experienced among the Latinx immigrant community in the United States, again, looking at it from a historical and collective trauma lens, it is important to recognize events in Latin America that push Latinx to the United States, US social political factors that pull immigrants, and legislation that have fueled undocumented migration from Latin America to the US, in addition to the impact structural racism has had on the mental health of Latinx immigrants once they're in the United States. In popular discourse, mental health inequities within the Latinx immigrant community are often discussed from a social determinants of health lens, which has been well documented. Essentially, documentation status should be included in the social determinants of health factors. But what is often omitted from discussion are the structures purposefully designed to negatively impact the mental health of Latinx immigrants. Essentially, what is often not discussed in the literature and the media are how social inequities of health are a product of structural racism and colonialization. Therefore, it is important to recognize that mental health inequities experienced by Latinx immigrants are rooted in colonial mentality, structural racism, fueling migration to the US. The origins of Latinx immigrant mental health concerns can be traced to Latinx migration to the US, which is complex and rooted in US territorial economic expansion their involvement in Latin America, especially in Mexico and the Northern Triangle between the 1970s to the 1990s, in which the US had their hands in a lot of what was going on in Latin America. Yet, Latinx migration to the United States in popular discourse is often described as a personal decision made by an individual or family, a simple one. But what is often overlooked and left out of discourse are structural factors, macroeconomic context that influence the decision to leave, and US political and economic involvement in the country of origin. What is also left out of discourse is how people would rather remain in the country of origin than leave. In addition, it is important to recognize the influence major US legislation has had on Latinx migration. Take, for example, the Bracero program during World War II, which opened the doors to Mexican guest workers, and the Immigration Reform and Control Act of 1986, which opened the doors for refugees and asylum seekers from Central America who were fleeing the wars in Guatemala and El Salvador. Similarly, it is important to also recognize how recent policies are impacting the mental health of Latinx migrants and fueling migration north. For example, the temporary protective status for Venezuelans, Title 42, and the Remain in Mexico policy, which have contributed to the crisis at our southern border that we're seeing. Folks may be asking, what do migration patterns have to do with mental health or physical health? Well, migration patterns provide contextual information on what was occurring at said time and how these events impact the mental and physical health of Latinx immigrants or Latinx in the United States, period. Migration patterns give us insights into stressful events contributing to trauma and post-traumatic stress disorder and other mental health concerns. What was causing family separation at said time? For example, the Bracero program, which I'll talk about in the next couple of slides, or immigration policy contributing to the mistrust often experienced by Latinx folks, which has manifested in the mistrust of health agencies, health institutions, mental health, physical health. Now, let's shift gears and look at 3 historical events that have influenced migration from Latin America to the United States, currently also continuing to affect the physical and mental health of Latinx immigrants as a result through intergenerational trauma and historical trauma. So let's briefly take a look at the civil wars in El Salvador, which was known as a result of a culmination of decades of oppression, human rights violations, and political tensions backed by the United States. The civil war in El Salvador took the lives of over more than 100,000 people. It was marked by death squads, extrajudicial executions, and forced disappearances. Again, keeping the trauma lens perspective, the government and military forced the killing and massacre of vulnerable populations such as women, children, elderly, those who were wounded or sick in the hospital. Most of the casualties during the war were civilians. Children often witnessed these attacks on their family, neighbors, and they themselves were victims also. They also became child soldiers recruited by both the military and guerrilla forces. A great film out there, if you're interested in knowing more about this, is called Innocent Voices, highly recommended. The US played a significant role in the Salvadorian Civil War. Under President Jimmy Carter's administration, the US supplied weapons and intelligence to the Salvadorian military. It has been documented that the US provided over $4.5 billion in aid and trained Salvadorian soldiers in tactics and torture. The Civil War resulted in mass exodus of people from El Salvador, again, the migration, with studies citing over 2 million people being displaced and the majority of them seeking refuge in the US. The war has been documented as one of the most gruesomest in recent history. And research examining the mental health of Salvadorian immigrants have found that the majority of Salvadorians who migrated to the US as a result of the war experienced severe trauma and psychological consequences of political violence and immigration. For example, one study found that 54% of their sample, which included Mexican, Salvadorians, and Guatemalan primary care patients living in the US, reported experiencing political violence in their country of origin, including 8% who reported torture. Of those who were exposed to political violence, 36% endorsed symptoms of depression and 18% endorsed symptoms of post-traumatic stress disorder. And of those who reported exposure to political violence, 56 met criteria for full-on post-traumatic stress disorder, right? And I talk about these events because they're not even 100 years old. We talk about history. To me, history is 1890s, early 1900s. These events are not even 100 or 50 years old. Now, a second historical event continuing to impact the migration continues to contribute to migration from Mexico to the US and the mental health of the Mexican immigrant community dates back to 1942, when the US negotiated an expansive mutual labor agreement with Mexico, which brought to life the Bracero program lasting 64 years. The Bracero program was the importation of Mexican guest labor to the US. The program prevented the disruption of agricultural production during World War II, minimizing food price inflation in the United States. The statistics suggest that an estimated 4.5 million labor contracts were signed. While on paper it appeared that Mexican guest workers would be treated humanely and fair, the realities were different. Once in the United States, braceros were exploited, forced to reside in harsh living conditions, such as cramped housing with poor plumbing, prohibited from unionizing, and sprayed with DDT and insecticide use in agriculture upon arrival to the US. A significant drawback to the Bracero program included a massive bilateral deportation policy, which limited the number of Bracero contracts and increased deportation of Mexican guest workers by the early 1950s once the war was over. However, the need for what Americans termed cheap labor resulted in an influx of unauthorized Mexican immigrants settling in U.S. border towns. The increase in unauthorized Mexican immigrant workers led to the rhetoric that the Mexican community was depleting relief from the poor and stealing American jobs, which is a rhetoric that we still hear today. This prompted Operation Wetback being a derogatory term, which is a massive military-style deportation practice of anyone who appears to be of Mexican ancestry. Many Braceros experienced unlawful deportation, family separation. So when we think about family separation, this has also occurred in the 1940s, 50s, and 60s, and abuse. Such prolonged exposure to social adversity has negatively affected the physical, psychological, and socioeconomic health of Braceros and their families today. Research examining the mental health of Mexican migrant farm workers has found that they're likely to experience stress, anxiety, and depression, as well as high levels of alcohol use. For example, one study found that among Mexican migrant farm workers, 52.2% met criteria for clinically meaningful depression, while 41.8% reported mild anxiety symptoms. Additionally, a second study found that the lifetime prevalence of any type of psychiatric disorder among Mexican migrant farm working men was 26.7%. For women, it was 16.8%, and for Mexicans who identified as indigenous, the rate was 26%. This includes bipolar, major depressive disorder, personality disorders, you name it. Now, a final historical event impacting migration from Guatemala to the US and the mental health of Guatemalan immigrants dates back to 1960. From 1960 to 1970, Guatemalan's president worked towards abolishing forced labor and returning the lands to the indigenous people. The plan was to nationalize and redistribute undeveloped land. At the time, the United Fruit Company, an American business, owned 42% of the land to cultivate bananas. However, soon after the president made the decree to nationalize land, Guatemala seized 40% of the land owned by the United Fruit Company. Politically and financially affronted by the president's decision, the US government staged anti-communist propaganda through the country and arranged a coup that was led by the Guatemala army. This eventually further fueled the war in Guatemala, which had a major impact on the Maya community. According to the Guatemala Army report, by 1980, the war had destroyed 440 villages, killed or disappeared 150 people, majority Maya, and displaced over 1 million individuals, with a large number fleeing to Mexico and the United States. The Guatemala Civil War has been said to have created a psychology of no future for many Guatemalans, especially among the Guatemalan Maya. As a result of decades of exploitation, displacement, and persecution, many men and women have taken the risk of potentially losing their lives crossing international borders into Mexico and the United States in hopes of earning an income that will allow them to send remittances to their country of origin for their family. While the official war ended, the violence in Guatemala has not. The extreme acts of violence during decades of war have contributed to a state plagued by femicide. The ongoing violence in post-war Guatemala has forced parents to part from their children in hopes that they have a chance of a better future in the United States. These family sacrifices have given a rise to an emergence of unaccompanied children crossing the United States in the past 10 years. Overall, Mayas from rural areas of Guatemala make up the majority of those who are now migrating to the United States. A lot of their land is being taken. Similarly to additional Latinx immigrant groups, high rates of depression, anxiety, and trauma have been found in the latest wave of Guatemalan immigrants. Specifically, one study found a positive correlation between trauma occurrence, alcohol use, and depression among a sample of 102 Mayas from Guatemala and Southeast Florida. More specifically, men were more susceptible to alcohol use, while women were more susceptible to depression. This is really important to note because we start to see a distinction between who's more likely or more susceptible to substance use concerns, or who's more susceptible to mood disorders, right? There's a gender difference there. Another study assessed a group of 46 Guatemalan immigrants for post-traumatic stress disorder and depression. The data showed that 30% of participants exhibited symptoms of post-traumatic stress and 8% exhibited symptoms of depression. Now let's shift gears and look at the mental health of Latinx immigrants once in the United States. So many of you may be asking, Oscar, so why is knowing the historical context so important when working with present day Latinx immigrants? Well, as I mentioned earlier, these events are not even 100 years old. A lot of the first generation immigrants experienced a lot of these crises, right? So in this case, the Salvadoran and immigrant, Salvadoran, Mexican, and Latinx, Salvadoran, Mexican, and Guatemalan community immigrants and their children are continuing to struggle as a result of these events. So what are the reasons why this is so important? Well, for one, it can help us better understand and conceptualize the manifestation of historical and collective trauma experienced by the people that we may be working with or encounter. Two, it can help us better understand the mental health it can help us better understand mental health historical trauma responses, which may include depression, anxiety, self-destructive behaviors, suicidal thoughts and behaviors, low levels of self-esteem, anger, difficulty recognizing or expressing emotions, and unresolved grief, among other concerns. Third, the historical context can help us better understand the origins of present-day social cultural barriers that impact Latinx immigrants, such as experiences of structural racism, issues around the mistrust in U.S. agencies, including healthcare systems. And fourth, understand the impact the U.S. has had on the mental health of Latinx immigrants before they even reached the United States. Now let's shift gears and bring attention to present day events and structures negatively impacting the mental health of Latinx immigrants. Current anti-Latinx sentiments and immigration policies add to the mental health challenges faced by Latinx immigrants as they attempt to survive and circumvent a country that needs them, but rejects and harms them all at the same time. The ability to access mental health care services and engage in treatment among Latinx immigrants has been indirectly and directly influenced by structures. And by structures, I mean federal and state legislation. Examples of federal and state legislation include that directly and indirectly impacting the mental health of Latinx immigrants include the Deferred Action of Childhood Arrivals, known as DACA, termination of temporary protective status for certain groups, Arizona State Bill 1070, Alabama House Bill 56, Title 42, MMP, and zero tolerance policy. Such immigrant-focused policies prompt hesitation to seek necessary treatment or preventative services in response to mental health and physical health concerns. Restrictive immigrant policies also affect treatment engagement and overall health of both immigrant and non-immigrant Latinos and their families, as is estimated, as statistics suggest that approximately 9 million Latinx families live in mixed status, with 10% of US-born children having one parent with undocumented status. Additionally, Latinx immigrants often worry that any type of contact with public health agencies can lead to their or their family's documentation status being shared with immigration authorities, therefore discouraging Latinx immigrants from seeking or engaging in any type of treatment. The fear experienced by Latinx immigrants of having their personal legal information shared with US Immigration and Customs Enforcement is completely valid. For example, in 2018, the Department of Health and Human Service and the Department of Homeland Security entered into an agreement to share information about unaccompanied migrant children in government custodies and their prospective sponsors. This led to the sharing of confidential therapeutic notes of migrant children by the Office of Refugee and Resettlement with ICE. When we think about therapy, we often talk about the importance of privacy. And here the therapeutic notes of these children were shared, right? So it's an ethical violation there. As noted in the previous slide, there are structures and legislations that directly and indirectly influence migration, which impacts the mental health of Latinx immigrants, which produce social inequities of health. Laws and policies across different levels, this includes federal, state, and local, have had and continue to contribute to negative impacts on the mental health of Latinx immigrants, especially the undocumented community, including DACA recipients. Oftentimes, policies and legislations include administrative rules that limit access to healthcare, education, health insurance, food assistance programs, and economic opportunities. Going back to my comment earlier, documentation status should be considered a social determinants of health because it's going to limit and determine who gets access to resources. In addition, at the federal level, there have been record level deportations in recent years compared to the early 2000s, and an increase in funding for law enforcement and immigration. Laws and policies that restrict immigration rights have had a negative effect on Latinx communities, including an increased likelihood of any including the likelihood of Latinx US-born children to grow up without a parent or parents, increased household poverty, low-level educational attainment for children, and low civic engagement. At the individual level, restrictive immigration policies result in heightened fear, restrictive mobility. By restrictive mobility, I mean people living in fear as a result of what's going on, so therefore not likely to seek jobs or go outside of the daily routine. Distrust in law enforcement and increase in stress and depression. For example, one study found high levels of depression and anxiety among Latinx immigrant men as a result of settling in states with tough immigration enforcement policies. A second study found that among a sample of 326 Latinx adults ages 55 and older, participants who had experienced great hardships as a result of U.S. immigration enforcement reported low levels of use of government services, perceived the situation for Latinx today worse than before, had greater fear of deportation, and perceived a low quality of life for themselves. Immigration enforcement also has resulted in fear and anxiety around deportation. The chronic stress can lead to social isolation, limited access to healthcare and social services, and economic uncertainty. By default, these experiences leave immigrants, especially undocumented immigrants, at a disadvantage, meaning increased likelihood of living in poverty, limited access to services, living in densely populated areas, which have been described as the social determinants of health, but essentially is a product of structural racism. Now, as a result, when working with US-born Latinx individuals, those who are documented, undocumented, immigrant folks, DACA recipients, or any Latinx individual in any setting, it is important to conceptualize presenting concerns from a historical approach, taking into account, conceptualizing from a holistic approach, taking into account historical events, immigration policies at the various levels, non-immigration policies, in addition to social cultural factors. Furthermore, when working with immigrant populations as providers, we need to pay extra attention to mesolevel factors, given that policies can impact the well-being and mental health of immigrant communities. So as providers or individuals working with Latinx populations, in this case, the Latinx immigrant population, we should be curious about past trauma as a result of war, natural disaster, political persecution, gang violence, and experiences during, pre, post, and during migration. In addition, this may take additional work, but we may need to be aware of federal immigration policies and consider how immigration policies may be playing a role in access to care, treatment adherence, trust, etc. And finally, taking a look at the local context and the role of structural racism. For example, how immigration friendly are our communities or systems that we work in or our services? So we're going to start to wrap up with the recommendations here. So when working with Latinx immigrants, interventions may need to include aspects of family healing and consider the well-being and wellness of other family members, as that may be contributing to an individual's levels of distress. Essentially, we need to work from a systems approach. We may want to ask, what is the role of family in this person's life? They may or may not have a family in the US. In addition, it is important to utilize interventions grounded on resilience and strength that are responsive and that validate the lived experience of and intersecting identities of Latinx immigrants. Take an inventory of strengths and values. Healing interventions should be personalized and grounded on empowerment and conceptualized from the client's strengths and values versus the presenting concern. Interventions may also need to focus on developing effective interpersonal relationships, community involvement, and the establishment of strong social supports. Essentially, how can they replicate their community and their country of origin in the United States? How can they replicate those relationships that they lost in the United States? Social support has been shown to be a significant protective factor for immigrant communities, so it's important to make sure that we're including that in our conceptualization in our treatment plan. We may also want to inquire about the role of spirituality, specifically fatalismo, which is the belief that God plays a significant role in our lives. So religion and spirituality have also been found to be a protective factor within this community. We may also want to assess adherence to cultural values. From research, we know that cultural values also serve as a protective factor. And the reason why we assess for cultural values is because we know that second, third, fourth, fifth generation, they're less likely to adhere to the cultural values compared to the first generation. Finally, we may want to gather contextual information to help us better understand the presenting concerns It is possible that given the situation, the emotional and behavioral responses is appropriate and not a symptom of a psychiatric disorder. So anyone who has migrated and experiencing difficulty sleeping, it could be a result of the trauma and it may not be a pathological presenting concern, right? Several sources also emphasize resilient responses, including narrative or survival, pride and ethnic identity or heritage, cultural practices such as kinship or traditions, dance, storytelling, traditional healing practices, and the role of elders, especially grandparents. Grandparents have also been shown to serve as a protective factor, or those conversations or cultural sayings tend to have a significant influence in the well-being of Latinxes in general. And finally, we often talk about the importance of interventions or any approach to be trauma informed, which I completely agree. And I want to take it a step further. Our interventions also need to be grief informed. And what I mean by grief informed is that, as you have heard me talk, this community has experienced a lot of loss. So not only do we need to address the trauma, we also need to address the grief. They may have lost family members along the journey, or maybe they lost their family because they migrated. They lost them, as a result of acculturation, losing their cultural identity, adapting to the U.S., maybe losing their language, their traditions, and so on. So there's a lot of grief being experienced by this community. So it's important that our interventions are both trauma informed and grief informed. And that wraps up my presentation. Again, thank you for the invitation to present, and I'll open it up for some questions if there are any.
I have a question. Could you provide us a little bit more information on the interventions that address grief?
Yeah, so there are some great interventions out there, especially looking at the stages of grief, right? There are 5 stages of grief. The only thing that the only concern with the current interventions of grief in terms of processing is that a lot of them have not been culturally adapted to the community. So a lot of them work from an individualistic perspective, focusing on the self, which again is totally appropriate. And when we're thinking about the Latinx community who come from a collectivistic cultural orientation, grief interventions may include family healing. How is family experiencing this loss? Or finding ways to deal with, to be present or deal with the grief. So for example, what I mean by that, a lot of undocumented folks who are unable to travel back to their country of origin to say goodbye to a family member, finding strategies around how to bridge that. So some studies have found that a lot of folks, being resourceful, are now using social media or apps to be present and saying their goodbyes. So finding strategies, strategies or interventions that are responsive, that are appropriate, such as that one, allows that person to say their goodbye versus not being able to say goodbye at all because of documentation status. So family intervention or family process is really critical in this grief approach, along with finding strategies that really validate or that are appropriate to how people say goodbye to family members. There's some work being developed around that area because usually traditional grief interventions are focused on the individual themselves, but when you come from a collectivistic cultural orientation, it takes a community to heal.
That is so profound. Thank you so much. We have some things in the chat here, Q&A. Most of the people are asking about the availability of your presentation following this event. It will be posted to the IHA Phoenix page. And then someone else is wanting, do you have any other strategies for disseminating your messages to the communities in the US who are receiving immigrants currently?
One of the things that we're doing, there's a couple of groups and I'm part of one, folks are interested, the Latinx Immigrant Health Alliance. So there's
Okay.
coalitions being built in certain regions of the US that really specifically focus on this population. So building in, scholarship or scholars of color, specifically in this case, Latinx's, there aren't that many. So being able to build those coalitions in different parts of the US who focus specifically on immigrant mental health is one way to be able to disseminate the research that's out there, disseminate the interventions. I'm based right now in New Haven. However, I collaborate with folks in California, in the Midwest, and so on. However, we need additional support to be able to disseminate that, right? And one of the resources I highly recommend for folks to look at into is the Latino Hispanic Mental Health Technology Transfer Center. They have substantial amount of resources there that can help, folks. So they have their website. We also have our website, the Latinx Immigrant Health Alliance. And all of our people is in our research and our interventions are focused on Latino mental health. So, small coalitions here, we're slowly trying to build our capacity. And yet, this is where we need to increase the number of people interested in the mental health field who are of color, making sure that they have access to education, making sure that they have funding opportunities so they themselves can be, take on the next task. But there are some efforts being done out there.
Thank you. Do you want me to continue we have a few thank you for your
Please.
presentation. Then it says, I'm a navigator, peer support, and this information is so important and makes sense on why the community is sometimes scared on asking for help or accepting help. You've already talked about you talked about some of the developmental programs that you're in, but would you consider these outreach programs as well?
Yeah, yes. And one thing that I saw a comment here, and I definitely want to stress this to folks. I think the field of mental health, specifically with vulnerable populations, so the Mental Health Technology Transfer Center, I think NAMI also does some great work. LEHA, our organization, does some great work. But one of the things that we can do at a local level, or even within our institutions, is try to find or implement a peer-based intervention. And what I mean by that are making sure that we have people that look like us, to speak the language, who can provide these resources, who are already in the community, right? We often talk about, when we think about, we have these beautiful buildings, these beautiful institutions, and yet people are not coming to these services. As a result, there's so much fear because there's valid fear. We as providers, we need to take the services that we've been developing, our interventions, our approaches to the community. If we really want to be community oriented, how can we partner, create peer interventions, or create interventions grounded in peer experiences? One of the things that we're currently doing, and my team is doing this, is we're trying to develop an intervention that is delivered by people with lived experience to bring in people to treatment. Yes, I think there's a large disconnect between providers and community members. And I think as providers, we need to reconceptualize, and as a system, we need to reconceptualize the way that we deliver health, mental health services.
Thank you.
Mm-hmm.
So one of our colleagues, Juan, made a point of saying that the documentation status wasn't his real issue, but he did have the chance to attend his father's funeral virtually. So I think, what you had mentioned about other ways to even say your goodbyes or be present in what's happening in your community is important. So yeah, did you want to say any more about that?
Well, it may not be. You bring up a great point, right? Barriers are not just documentation status, right? This person could have been it could have been due to financial strains, which are a result of limited opportunities of upward mobility in employment.
Right.
And that could play a role. So taking into consideration all the factors that are out there that are really having a negative effect or that limit people's ability to mobilize, essentially.
Right.
I see a comment here by Patricia Sandoval. Thank you for the comment. Any books on this topic? Yes, actually, I can send Jeanette a link. Our book is actually coming out that talks about all of this, essentially. It really focuses, and again, it's being published by the Hispanic and Latino Mental Health Technology Transfer Center. And our book focuses on it's a 6-chapter book. It's coming out actually next Friday, and it really focuses on these 4 countries. It focuses on Mexico, in the northern triangle countries of El Salvador, Guatemala, and Honduras. And we take a historical approach. So we go into the history and essentially start taking pieces from the history and explaining Latino behavior in the United States. Why is it that we have encouraged our children to suppress our mother tongue? Why is it that we value certain features based on colorism? Why is it that we respond maybe fear responses as a result of mistrust, right? In terms of trauma, I saw a question here about trauma. Trauma has a significant effect on the cognition in terms of how we respond, how we cope, how we engage with other people. Do we have difficulties establishing relationships as a result of, maybe potential trauma, as a result of structural racism? So our book really gets at the history. It provides interventions, it provides context. So I'll send the link to Jeanette. It's free to download for everyone. Again, it comes out next Friday, and it really gets at the core of everything here. It pretty much this presentation with a lot more information.
Okay, thank you so much. We need to wrap it up here. I want to thank Dr. Rojas Perez. I know this would be so good if it was a full day, just him, and all of his resources and knowledge. Maybe we can have him back at another time. And then we will definitely get his resources and information out to everybody. And we have all of the questions. If we weren't able to answer some during this session, we'll be able to address those too with all the participants.
I see one last thing. I see some folks want to know the name of the book. It's called, the title is ¿Quiénes somos y de dónde venimos? Working with Latinx Immigrants in the U.S.
Okay, thanks. That's really critical. Well, I really appreciate this presentation. It's been very, very valuable. And we will see you, everyone, at the next presentation with Dr. Wright. And so you'll just need to log into that session. Thank you, everybody.
Thank you.